Hey everyone, Justin Jeline here. I wanted to share this evidence-based guide with you on shockwave therapy, and specifically I wanted to talk about some of the latest research and how it can be used for athletes. Now, shockwave therapy has received a lot of attention in recent research, and it's gotten a lot of interest from athletes. However, there's some burning questions from clinicians, such as, does shockwave therapy actually work? And is it any different than ultrasound? And what do I use it for? Which body parts or which injuries do I actually use it for? I will go through all of those with you. And first, I actually want to go over what shockwave therapy is. So shockwave therapy, or extracorporeal shockwave therapy, is going to be using high energy sound waves directed towards an injury site. Now, it's going to be doing three things that we know of: promote tissue and bone healing, provide pain relief, and reduce spasticity. Now, there's more evidence needed on each and every single one of these. However, we know that it does promote tissue and bone healing. And what it does is it's going to decrease the expressions of inflammatory mediators, and it's going to promote collagen, tenocytes, and osteogenesis. It's also going to be able to promote neovascularization as well. Another thing that extracorporeal shockwave therapy does, or shockwave therapy, is going to be providing some pain relief. Now, we don't really know how long it provides pain relief for, but we do know that it's using hyperstimulation, and it's also using the gate control theory. And then lastly, we do see that it's used to reduce spasticity as well. Now, the mechanism of action is a little unclear for this, and more research is really needed to understand the mechanism of action for shockwave therapy, but this is what we know right now, and we know that it can benefit certain pathologies. Now, there's several shockwave types that you can use, and two of them are going to be radial and focused shockwaves. So radial shockwaves are going to be more often used for superficial treatment areas, and focused shockwaves are going to be more for deep treatment areas. However, we do see evidence in the research trending towards using a combination of both radial and focused shockwaves, so we notice that patients are getting some better outcomes when they're combined. I will pause here for a moment and say there is a need for continual research here. We don't fully understand the mechanism of action, and we don't truly understand the benefits of shockwave therapy. However, we do see a couple articles, and when we look through the research, we do see some things showing some emerging evidence that it works. However, I want to make a very clear statement here that we are not 100% sure how shockwave works, and we are not 100% clear if it truly improves patient outcomes. What I want to do with you is go over specifically what we know in the research and what we don't know to be able to make informed decisions on how to help athletes and how to help patients improve their outcomes. So, shockwave therapy, let's talk about the clinically relevant injuries. And you might be wondering to yourself, well, shockwave therapy is really just ultrasound, or shockwave therapy is just some new gadget. Well, I will say that we have seen over the years that ultrasound doesn't work that well. While there may be some studies that say continual ultrasound does help, we've generally come to the conclusion that ultrasound doesn't work that well. However, there's a key difference between shockwave therapy and ultrasound. Ultrasound is going to use sound waves to be able to warm tissues. However, shockwave, as we can tell here, is promoting tissue regrowth. It's helping either spasticity reduce, or it's being able to be used in a way that can benefit patients' outcomes. Now, we are going to use that specifically to talk about how we can use it for clinically relevant injuries. Now, each of these are a little bit different, and we'll kind of put it into three categories: tendinopathies or tissues. We'll talk about the bone as well, and then lastly, we'll talk about a little bit of spasticity as well. So first, let's go over Achilles tendinopathy. Now, Achilles tendinopathy can be a useful pathology to be able to benefit from shockwave therapy. And as we go through, we can see that improved outcomes for mid-portion Achilles tendinopathy using shockwave therapy coupled with exercises was beneficial. We also see that those exercises do support eccentric loading over concentric exercise. We also saw that Achilles tendinopathy was benefiting from shockwave therapy to reduce the pain by hyperstimulation. Now, all of these studies that we're going over are going to be focusing on two main studies that were done. One by Tenford et al., which was published in the Journal of PM&R, and that was a 2022 article. And then we also have an article by Ream et al., published in 2024, which was published in the British Journal of Sports Medicine. Both of those articles are great when they look at these clinically relevant injuries, and I would encourage you, if shockwave therapy is something of your interest, go look at those articles because they do a lot to be able to give you information on how to help people with shockwave therapy. They also are very clear with where the limitations of the research are and what we know and don't know. All the information is at the bottom of this guide, so make sure to check it out if you'd like to. Let's go over our next injury here, which is plantar fasciitis. So for plantar fasciitis, it was found that shockwave therapy alone improved outcomes versus no treatment or standard of care. And we really do need more evidence to confirm this, because this was really only one article or maybe two that was supporting this. However, we are currently seeing that plantar fasciitis does benefit from shockwave therapy. One of the shocking things that we saw, pun intended, was that patellar tendinopathy doesn't necessarily improve with shockwave therapy. They saw mixed outcomes in their RTCs or RCTs, and they don't actually see the evidence is supporting shockwave therapy. Now, there's a couple different ways that you can use shockwave therapy. You can use shockwave therapy either alone by itself, or you can use it with the standard of care, or you can use it in lieu of the standard of care. Now, you might be kind of thinking to yourself, how does that exactly work? So let me break it down one more time so we can understand. So it's shockwave alone, shockwave plus the standard of care, or shockwave versus other treatments. Other treatments mean like dry needling or potentially ultrasound. So when we look at these studies, it's important to go through and really pay attention to how they're using the shockwave therapy, so you can make sure that you're either reproducing that with patients or that you're following those guidelines. So let's go over our next injury here, which would be IT band syndrome. So IT band syndrome did improve clinical outcomes when combined with therapeutic exercise. And we saw this in several research articles, so we do see some promising evidence here. However, it doesn't specify which exercise was beneficial with IT band syndrome. One of the interesting articles that went over lateral epicondylitis specifically talked about how shockwave therapy can reduce pain and it can actually improve patient outcomes. Now, the reason they're seeing that is because the pain reduction allowed these patients to be able to do more corrective exercises and have more tolerance to exercise. However, what was unclear with this article was really how long those patients were in a pain-reduced state for, and how long and how much treatment they actually underwent with shockwave therapy. What they did see was that 50% pain reduction was seen. So that is promising, but again, more research is really needed to understand if this is a viable treatment option. Let's get into stress fractures as well. So bone or delayed bone unions or bone healing was one of the primary focuses of shockwave therapy. And specifically, one of the best researched pathologies out there is medial tibial stress fractures. And what they did see was that medial tibial stress fractures, or shin splints, improved in combination with exercise. This was pretty promising, and a lot of these articles supported that. Another one was avascular necrosis, and the most information out there was on avascular necrosis of the femoral head. Again, we saw that shockwave therapy facilitated bone remodeling and vascularization. Also, I mentioned spasticity above. Now, spasticity was seen in one or two articles. It is really still emerging. However, we do see that shockwave therapy is reducing spasticity in patients with things like cerebral palsy, stroke, and really upper and lower limb spasticity. And lastly, I want to go over bone marrow edema. Bone marrow edema can be very painful. It can be seen after surgery or surgical intervention, or it can really be from a lot of different issues. Rheumatoid arthritis is another issue that it can be caused from. So we did see reductions in bone marrow edema. Again, more research is needed here. The research that was out there was specifically on the femoral head and the MTP. So now that we've gone over some of the clinically relevant injuries that shockwave therapy has been researched on, let's talk about what the treatment parameters would be for these injuries and for different types of injuries. So shockwave therapy can be used with different generators that we've talked about before, radial, focused. And as we can see here, the radial is going to get more superficial tissue. So that's going to be, the generator is going to put a wider sound wave out, and it's then going to cover that pain point. We also see that the focused shockwave is going to be a wider generator that's going to then narrow the focus towards the pain point. One of the things the research was very clear on was that it's important to know where the treatment site is and the anatomy is. Some even went as far to use imaging to be able to understand where the treatment area was and to confirm that. Some of that was ultrasound, and they used a variety of different imaging. So again, when we look at the different generators, we do see that they're focusing on maybe superficial or a more focused treatment area. However, for example, with Achilles tendinopathy, they did a combination of radial and focused and saw beneficial outcomes. Now, they haven't gone as far to do just radial or just focused, so it would be interesting to see those articles and to understand how those benefits differ between just radial and just focused therapies. However, we do see that combinations of radial and focused is the emerging trend for treatments. We also see that the frequency most studies are suggesting is 1 time a week for shockwave therapy for 3 to 5 weeks. Some treatments did go a little longer. However, this was the norm that they saw. And lastly, I'll say continued research is really needed here. We need to understand better treatment parameter guidelines. They don't have a lot of treatment guidelines out there. They have said that shockwave therapy helps for specific things, but they haven't gone as far to say that this specific frequency, duration, or this specific type of generator is important to use. So I'd love to see that come out in the research. Now, with any treatment that we use, it's always important to think about side effects. It's always important to think about contraindications. And so this is from that Tenford article and the PM&R in 2022. And specifically, I want to talk about a couple things that can be a side effect. So they did find some skin arrhythmia can be caused. They can also see some pain at the applicator site. And they also see that there's sometimes some superficial edema as well. Some found that there was headaches and migraines, but they didn't see that come up quite as often. Now let's talk about contraindications. Some of these are pretty important because we want to make sure we're not doing shockwave therapy on anyone that would be resulting in a worse clinical outcome or cause other pathology. So we've broke this down into absolute contraindications, relative contraindications, and important considerations. And I actually want to go from the bottom up here because there are some very important considerations when it comes to shockwave therapy. And some of them are going to be using NSAIDs or non-steroidal anti-inflammatory drugs. And this is because you can see that shockwave therapy, one of the things it does, it promotes tissue regrowth. It promotes healing. So if you're using an anti-inflammatory, or if potentially you've recently received a corticosteroid injection, this may not be a good treatment option for you because it is not going to allow that shockwave therapy to do what it's designed to do or to promote that tissue regrowth. Now let's go to the relative contraindications, and that's being using this on brain or nerves and specifically the lung. We want to be very careful with that. There was some evidence that was out there saying epiphyseal plates shouldn't be in the treatment focus. And then absolute contraindications, tumors. We do not want to promote growth of a tumor, active infections, and then pregnancy as well. Now, let's review some of the clinical pearls here because I think it's very important. It is clear that this research is mixed. However, there are some takeaways that you should take. So shockwave therapy is different than ultrasound. While we certainly am not sure that this is a foolproof treatment modality, we are seeing some emerging evidence that can be a treatment option to facilitate tissue healing, bone growth, pain relief, and reduce spasticity. However, we also notice that there are patients that it improves and patients that it doesn't necessarily work with. Patellar tendinopathy doesn't really work with shockwave therapy, at least in the research that we see right now. And it has been fairly widely researched with patellar tendinopathy. Unfortunately, we don't see the outcomes we were hoping for. However, Achilles tendinopathy, plantar fasciitis, IT band syndrome, lateral epicondylitis, medial tibial stress syndrome, or shin splints, avascular necrosis of the femoral head, and spasticity of the upper and lower extremities all seem to have emerging evidence to support shockwave therapy. And while our treatment parameters are not 100% clear, we have seen that 1 time a week for 3 to 5 weeks has been beneficial, and we also do see a combination of radial and focused shockwave therapy. We really do need some better evidence to be able to understand specific treatment parameters, and we need better evidence to be able to support what shockwave therapy does for athletes and physically active individuals. Now, overall, I am very excited that there's been some research on shockwave therapy. Personally, when I first heard shockwave therapy, I said to myself, that's just a fancy ultrasound. Obviously, it's different. However, I would really like to see some more research on this. And I would love to see that research go in the direction of comparing the standard of care versus plus shockwave versus a sham shockwave and the standard of care. So really isolating whether the standard of care on its own plus shockwave is going to be helpful, or whether the standard of care on its own is still better than using shockwave and the standard of care. And then lastly, it would be really important and really helpful to see some research on other modalities as well. How does shockwave compare to dry needling? How does shockwave compare to other modalities that are commonly used? So that would be a really interesting thing to see in the research. Obviously, with the limited downsides of shockwave therapy, it is tempting as something to use, especially if it could avoid a PRP injection or cortisone injection. However, again, more research is needed. Now, I hope you liked this video, and make sure to check out our other videos on evidence-based guides. If you have any questions, feel free to reach out. Otherwise, I hope to see you next time, which I'm sure will be soon.